So let's take a look at this other side. We have the same scenario as before, and now I'm going to show you what the biomimetic preparation would look like on this tooth. We're going to do a ceramic onlay, whereas this one was a crown. We're going to do a ceramic onlay here, but we're going to try to keep as much of the tooth that's healthy and intact. And so we're looking at the silver filling right here. We have crack, crack, crack. This whole side of the tooth is perfectly healthy, and I want to try to keep as much of the healthy tooth as possible and restore the rest with adhesion. So let's do the preparation, and you can compare for yourself how much tooth we're saving. Okay, so as before, our first goal is reducing the volume. Here I'm going to take out the old silver filling first, because in the biomimetic approach I typically want to take a look at the tooth and see how much we're dealing with, and also to analyze the tooth to see if there are any cracks or anything inside there that would make me change my preparation design. So first things first is remove the old silver filling. Okay, so once we have that completed, we take a look, and what we're looking for is if there's any cracks under the tooth, if there's anything that would change my preparation design, like for example, if there was a large crack running right down the middle, or if the tooth was very symptomatic, I might go ahead and take away a little bit off the side over here. But in this case, let's just say our cracks are really on the side right next to where the amalgam was finishing, which is very common because right where that amalgam or that silver filling was terminating, every time you would chew, this little thin area of tooth would start bending and flexing and a crack would start. Sometimes this crack would join from this side all the way to this side. Other times, if we catch it early enough, we're still kind of able to keep more and more of the tooth. So let's say in this case we have no cracks under here. Now we just need to take care of these cracks out here, especially if they're into dentin. If they're just in the enamel, we actually don't even need to extend. But if they are deeper in, and I can see from the side right here that they're also into the dentin, then we're going to want to go ahead and include those in our preparation design. So I'm going to do that now. Okay, now if that's all we were to take away, we would be having what's called an inlay. Inlay means it's not covering any of the peaks of the tooth. If we're covering a peak of the tooth, it's called an onlay. And this is a plastic tooth, so it's going to be hard to explain this perfectly, but typically when you have those 3 cracks that I explained there, it's very normal that the cracks are kind of extending right under the base of this cusp over here as well, connecting between that side and this side. So I'm going to show you a very typical preparation, which is called an onlay, but only the parts that the cracks were affecting are going to be removed. So I'm going to also take away this peak and this peak, but I'm not going to take it all the way down. If you look over here, I'm not going to take it all the way down to the gum line. We're going to stay just a couple millimeters from the top surface of the tooth down. So we're still going to save all this part on the side without removing. So let me do that reduction and you'll see what I'm talking about. So I need to turn this around to get a better look here. Here we go. Okay, so we have essentially the completed onlay preparation. Just need to make sure we have a little bit of space right over here, which we'd use a special strip for, but you can compare these two. So in the crown, we have to take away from, let's turn this so you can see it better. In the crown, we have to take away from the top and all the sides and place a margin near the gum all the way around the tooth, because this margin continues all the way around near the gum line, okay? The crown would go over the top of the tooth, cover the top, and come all the way down to the gum. For the onlay over here, we only took away the parts that were damaged. So on the inside here, we have a lot of tooth that's above the gum line. We only removed the area the silver filling was in the cracks, and then we kind of joined everything together. We didn't touch the outside at all. So we're just gonna have a piece of ceramic that just sits right there. And what's important is with the right bond, with a very strong glue or something that really brings it together, that's going to behave and function at least as well, if not significantly better than the crown. Old traditional approaches would say that we don't have strong enough glues or techniques to do that, but the reality is we do. The material's there, the science is there, the techniques are there. We're able to keep all this tooth intact and just restore that portion that's missing and have a perfectly strong tooth without taking away so much like we did for this crown over here. So that's the biomimetic approach. It's called an onlay, but more important than what it's called, the onlay, it's how it's going to be done, which is glued very strongly, because you can still do an onlay. A lot of people do onlays, but if they're not gluing them very strong and getting the same bond, then it's not going to last and survive. So sometimes when somebody says, hey, an onlay is not going to last that long, it's going to be breaking or fracturing, it might be true in their hands, but with the right technique, this onlay will last a long time. I've been doing things like this for over 10 years, and these things have held up incredibly well. There's nothing to indicate that we should be shaving away more tooth on this so that we can make it into a crown, okay? So I hope you can see that there's a lot of advantages. In this video, I wanted to show you how much tooth structure we can save with the biomimetic approach and how significant that savings is. When you look at this, we're saving at least 30% of the tooth reduction compared to that. This is a 70% reduction. This is somewhere like 30, 35. So we're saving a very large percentage of the tooth. We minimize the chance of root canal. We have something that's more natural, easier to keep clean, and a whole lot of other advantages that we're going to be covering. So I hope that makes sense, and please stay tuned. Come back for the next videos. We're going to be covering a lot more interesting stuff on biomimetic dentistry. Alright guys, so in this video I showed you the amount of tooth structure that we removed for a traditional crown versus the amount of tooth structure for a biomimetic onlay. And I'm sure you saw the significant savings, because that was about 40%, actually between 30 and 40% tooth savings versus a crown, which is very significant. In the long run, the more of the tooth we have, the less chance of root canals, the less chance of sensitivity, the less chance of complications such as cracks and so on in the tooth, because the more of the tooth we save, the stronger that we can restore it. That's the biomimetic approach. Save more tooth structure and try to mimic the natural tooth. Very important is to try to bond or glue as strongly as possible, because there's a lot of people that'll say an onlay is going to break or fracture or it's not strong enough. And remember I told you that enamel is very brittle, but when it's joined to dentin with the right bond or the right glue, it can become much stronger as a whole. Same thing with these restorations. If you take that onlay and you bond it the way that we're supposed to in the biomimetic approach, we get a perfectly long-lasting restoration, and there's no reason to remove all that extra tooth structure to try to strengthen the tooth. The more logical, natural, holistic way of conserving this tooth would be to save more of it, and in the long run that's the best approach. I hope that makes sense, and please stay tuned. We'll see you next time for another video on this biomimetic dental course.